Normally, when you get an infection, your body is able to handle it and you get well. However, sometimes the immune system can overreact when fighting the infection and begin to damage the body's organs. This is a condition which we refer to as sepsis. 70% of all sepsis cases start at home and most often begin with a local infection such as pneumonia, urinary tract infection, or a wound infection. If the bacteria from the local infection spread or secrete toxic substances into the bloodstream, the immune system can sometimes overreact, causing inflammation throughout the body. This is called sepsis. Blood vessels begin to leak, and the blood pressure drops, making it difficult for the blood to transport oxygen to the body's vital organs. This may result in damage to organs such as the lungs, kidneys, brain, or heart. In the worst case, the patient dies. Patients with sepsis may deteriorate rapidly within hours. Detecting sepsis in time is therefore crucial. Symptoms you should watch out for are confusion and slurred speech, severe breathlessness, vomiting and diarrhea, extreme shivering and fever, severe pain and muscle weakness, fast heart rate, skin mottled or discolored, low blood pressure, and low urine production. When it comes to sepsis in the elderly, it can be particularly difficult to catch the signs of sepsis in time. For example, fever occurs less frequently in sepsis in the elderly, and in some cases, a very low temperature can be a sign of severe disease. Symptoms such as confusion can also be missed, as this sometimes occurs for other reasons in the elderly. But be aware of any new signs of confusion or affected consciousness. This may be a sign of sepsis. If an elderly person exhibits several of the symptoms of sepsis, do not hesitate. Rapid hospital treatment increases the chances of recovery. Keep in mind that some elderly people have an individual care plan that should be considered before calling an ambulance. You can read more about how you can interpret the different symptoms of sepsis in older people in our detailed information. Learn more about sepsis at sepsisfonden.se.